Imagine waking up one day unable to lift your foot, a condition known as foot drop. For many, this signals a long road of medical intervention, often ending in surgery. But what if recovery could happen on its own? Today, we explore a remarkable case where a young man experienced complete foot drop due to a lumbar disc herniation, yet made a spontaneous and significant recovery without surgery. This story challenges our expectations and offers hope for those facing similar neurological issues. Let's dive into the details of this neurological surprise and see what lessons can be learned for both patients and clinicians. Foot drop is the inability to lift the front part of the foot, making walking difficult and sometimes dangerous. It can result from either central or peripheral neurological problems. Central causes include diseases affecting the brain or spinal cord, while peripheral causes often involve nerve injuries or compression, such as lumbar radiculopathy. In this case, the culprit was a herniated disc in the lower spine, compressing the nerves responsible for foot movement. Understanding the underlying cause is crucial for determining the best treatment approach and predicting recovery chances. Our story centers on a 32-year-old man who visited the clinic with a 15-day history of low back pain. The pain radiated down his left leg, worsening with movement. Initially, he managed his discomfort with rest and painkillers, which helped reduce the pain. However, after 5 days, he noticed he could no longer lift his left foot off the ground, forcing him to take exaggerated steps to walk. There was no history of trauma or injury, making the sudden onset of foot drop even more concerning. This marked the beginning of his unexpected journey. During his neurological evaluation, the patient exhibited complete foot drop on the left side, meaning he had no ability to lift his foot. There was also mild weakness in his hip and knee, but no sensory loss or problems with bowel and bladder control. Reflexes in both legs were normal, and a straight leg raise test reproduced his radiating pain. Passive movement of his feet was normal, and there was no tenderness. These findings pointed toward a nerve root problem, most likely related to the lumbar spine. To confirm the diagnosis, doctors ordered an MRI of the lumbar spine. The images revealed a degenerated and protruding disc at the L4-L5 level, compressing the nerve root on the left side. This type of disc herniation is a well-known cause of foot drop, as it can directly affect the nerves controlling foot movement. The MRI findings matched the patient's symptoms, confirming that the foot drop was due to nerve compression from the herniated disc. Despite the severity of his symptoms, the patient declined surgery. Instead, he opted for conservative management, which included medications and physical therapy. He was prescribed muscle relaxants and anti-inflammatory drugs to reduce pain and inflammation. The medical team scheduled regular follow-ups to monitor his progress, ready to consider surgery if his condition worsened. This decision set the stage for an unexpected outcome. Amazingly, just 10 days after starting conservative treatment, the patient showed significant improvement. His foot drop improved from complete paralysis to nearly normal strength, and he could walk without the high-stepping gait. Encouraged by this progress, the medical team continued with conservative management, reserving surgery only as a backup if his symptoms returned or worsened. This rapid recovery was both surprising and encouraging. At his second follow-up, 3 weeks after the initial visit, the patient had regained full strength in his foot and normal gait. There was no longer any sign of foot drop, and his back pain had also resolved. This complete recovery without surgery is extremely rare in cases of lumbar disc herniation with foot drop, making this case particularly noteworthy. The patient continued to be monitored for any recurrence or new symptoms. Foot drop can result from a variety of causes. Central nervous system disorders, such as motor neuron disease or brain lesions, can lead to foot drop. More commonly, peripheral nerve injuries or compressions, like those seen in lumbar disc herniation, are responsible. The specific nerves involved determine the pattern of weakness and help clinicians localize the problem. In this case, involvement of the L5 nerve root explained the patient's symptoms. Several factors influence the likelihood of recovery from foot drop. These include the cause of the foot drop, the strength of the affected muscles at presentation, how long the foot drop has been present, the patient's age, and whether there is associated leg pain. The location and number of affected discs also play a role. Generally, weaker muscle power and longer duration of symptoms predict poorer outcomes, especially if surgery is delayed. Additionally, foot drop due to lumbar disc herniation is considered an indication for early surgery, aiming to relieve nerve compression and restore function. However, this case demonstrates that conservative management can sometimes lead to full recovery, especially when the duration of symptoms is short and there is no permanent nerve damage. The decision between surgery and conservative care should be individualized, based on clinical findings and patient preferences. One possible explanation for the patient's rapid recovery is the reduction of inflammation around the compressed nerve root. Anti-inflammatory medications can decrease swelling, relieving pressure on the nerve, and allowing function to return. This highlights the importance of considering inflammation as a factor in nerve compression syndromes and supports the use of medications as a first-line treatment in select cases. This case underscores the importance of thorough clinical examination and careful history-taking. Positive predictors for spontaneous recovery include younger age, good initial muscle strength, short duration of symptoms, and absence of urinary complaints. Sequential neurological exams are essential for monitoring progress and guiding treatment decisions. Clinicians should consider a trial of conservative management in select patients before proceeding to surgery. Spontaneous recovery of complete foot drop due to lumbar disc herniation is extremely rare, with very few cases reported in medical literature. Most patients require surgery for meaningful improvement. This case adds to the limited evidence suggesting that, in select situations, conservative management can be successful. More research is needed to identify which patients are most likely to benefit from non-surgical treatment. In summary, this case challenges the conventional wisdom that surgery is always necessary for foot drop caused by lumbar disc herniation. It highlights the potential for spontaneous recovery with conservative management in carefully selected patients. The key is individualized care, close monitoring, and a willingness to adapt the treatment plan as the patient's condition evolves. For patients and clinicians alike, this story offers hope and a reminder to consider all options before making major medical decisions.